Receiving medical test results can sometimes feel a bit unsettling, especially when the words are unfamiliar or imply something unexpected. You might open a letter, see the phrase abnormal pap smear, and immediately wonder what it means for your health and what steps you need to take. So, what does an abnormal pap smear letter mean? It means that your pap test, which screens for cervical cancer, found some cells on your cervix that are not typical. This result is quite common, and in most cases, it does not mean you have cancer. Instead, it often indicates mild cell changes, inflammation, or the presence of the human papillomavirus, known as HPV, which is a common virus that can cause these changes. The reason for these cell changes, or abnormalities, is primarily due to the body's natural processes or common viral infections. The pap smear looks for changes in cervical cells. Many times these changes are minor and can resolve on their own, especially if caused by a temporary infection or inflammation. However, some changes can be a sign of infection with certain types of HPV, which can lead to more significant cell alterations over time if left unmonitored. It is your body's way of giving you an early heads-up, allowing for timely follow-up. When you receive an abnormal pap smear letter, the most important next step is to follow your doctor's recommendations for further evaluation. This might involve a repeat pap test in a few months, or a procedure called a colposcopy. During a colposcopy, a healthcare provider uses a special magnifying instrument to get a closer look at your cervix and may take small tissue samples, called biopsies, to examine the cells more thoroughly. Your care team will guide you through exactly what is needed next. It is helpful to remember that an abnormal pap result falls on a spectrum. You might see terms like a ASCUS, which stands for atypical squamous cells of undetermined significance, or LSIL, which means low-grade squamous intraepithelial lesion. A ASCUS is often a very mild change and might simply requiring watchful waiting, while LSIL indicates slightly more pronounced, but still low-grade changes. The specific terminology in your letter helps your doctor determine the most appropriate follow-up plan for you. Ultimately, an abnormal pap smear letter is a crucial part of your health protection. It serves as an early warning system, allowing you and your healthcare provider to monitor your cervical health proactively and intervene if necessary. Understanding these results and acting on them promptly is how you protect yourself and keep your body healthy.